So you've injured your ACL and you think you might need surgery. What are the risks that are involved? Today I'll be talking to a doctor and a physio to find out just that. ACL surgery sounds kind of scary. We've been talking through it, a little bit intimidating. Can you walk us through the actual procedure?
So it is exactly as it sounds. We are recreating the ACL, which is the ligament inside the knee that provides stability. And to do that, we need a piece of tissue which we can place in the place where the ACL has been torn. And there are lots of different ways of doing this operation, with lots of different grafts that we can use to recreate the ACL. That graft, in the majority of cases, comes from your own body. So there are different things we can use, such as your hamstrings, which is the commonest way of doing this operation, or a piece of your patella tendon, or a piece of your quadriceps tendon, all tendons around the knee joint itself. Or it can be donated graft from people who have donated it in the past. There are lots of different ways, and the most common way, and the way that I do the majority of my ACLs, is using your hamstring tendons. The way we reconstruct the ACL is by drilling some tunnels through the knee itself and placing this bit of graft inside the knee and holding it in a very stiff way to provide that stability, to restore that stability to where it was before.
And how long would a typical surgery take?
It's variable depending on how much damage there has been to the knee and to the other structures, but it can last anywhere from 60 to 90 minutes or thereabouts.
Someone's just had their ACL surgery, they're at the very beginning stages. What is the first phase of their recovery going to look like?
Physio-wise, we see you on the ward pretty much immediately after the operation. Usually you are weight bearers, pain allows. You'll be using crutches initially.
Okay.
Obviously different operations, there might be slight changes to the protocol, but routinely it's weight bearers, pain allows. Crutches are there to reduce the pain. You come off the crutches within a week, 2 weeks. Ideally, so it's not a long-term thing. On the ward as well, we'll start you with your basic exercises. So there'll be some gentle range of movement, gentle muscle contractions, just to keep the knee ticking over in that first week or two when there's going to be high levels of pain.
When you say gentle range of motion, what does that look like?
So it's generally seated or bed-based knee range of movement. So it's
Sounds like my type of movement.
Yeah, the easy stuff. Gets a lot harder. So it's like the bending and the straightening of the knee. So it's all within comfortable ranges.
Okay.
We're not expecting patients to force through pain initially, but it's just to start that journey of, right, we need to get the knee moving.
Now the big question, what are the risks that are involved with surgery?
This is not a minor operation. It's also not a major life-threatening operation. It's kind of somewhere in between. It's usually a day case operation, which means you get to go home the same day. And the risks, they can be kind of divided into different groups. One is the anesthetic risk. So the risks are being put to sleep, and that's really very safe these days, but there are still some risks that the anaesthetist can talk to you about. Specific to ACL reconstructions, there are things that can affect your knee. So it can cause stiffness, pain, where the drills, where there are tunnels drilled into the bone, there can potentially be fractures. The ACL can re-rupture again in the future, or you can develop things like a deep vein thrombosis, a clot inside the leg. There are other risks, of course, but it's important to note that the majority of cases go without any complications, and these complications occur in less than 5% of patients. So it is very safe surgery, and even if some of these complications do occur, like an infection, we can treat them. You may need some further surgery or some further medication, but in a lot of those cases, they're treatable complications.
So you said it's less than 5% of people have any kind of complications.
That's right.
With their surgery, post-surgery.
That's right. So focus on the good bit. It's actually quite safe surgery. It's just any patient undergoing surgery needs to know the fine print.
And what can the patients do to minimise risk?
Essentially follow the protocol. It's as simple as that.
Listen.
Yeah, basically. So, and be patient with it. So if someone's telling you, right, you're allowed to move the knee this much, try and achieve that target.
Yeah.
If they're saying you can put weight through the leg, put weight through the leg. Don't do the opposite of what you're being told.
I can imagine if you're dealing with athletes, so that can be particularly difficult at times.
Yeah, it can be. Or, well, yeah, athletes or just the general population, they want to get better as quickly as possible. The surgery is part of the journey. They might have been injured for months prior to it, so they want to get back to normal as quickly as humanly possible, but you must be patient with it. There's a reason why we say, don't do these things, do these things instead.
So don't let your frustrations take over, basically.
Yeah, you will get frustrated, you will be impatient, you will be annoyed. Those are normal feelings in the recovery, in any recovery.
Take it out on your physio.
Take it out on your physio. We'll absorb it, we'll deal with it for you, we can counsel you through it as well.
Fabulous. Thanks for watching. For more videos on the ACL, click here.